My name is Dr. Egwang. I'm talking to you today about nodding disease syndrome. Nodding disease syndrome is a devastating, enigmatic brain disease of children in northern Uganda. When you watch YouTube videos of children with nodding disease, you really feel deeply their pain and suffering, and also that of their parents. These children and their parents are waiting for answers. Hopefully, this project can provide those answers. Nodding disease syndrome is probably a complicated brain disease. We know the following. There's a consistent association between nodding disease syndrome and onchocerciasis. Onchocerciasis is a parasitic disease caused by a roundworm called Onchocerca volvulus. We also know that there is a very close amino acid similarity between Onchocerca volvulus protein, OV16, and a brain protein, pitch1. pitch1 is important for hippocampal brain function, especially the function associated with memory and learning. We speculate that autoimmune destruction of pitch1 occurs because the similarity with the worm protein dupes the immune system into attacking pitch1. And when pitch1 is destroyed, that probably impairs brain function. We speculate that this might result in low levels of pitch1. Low levels of pitch1 have been demonstrated in Alzheimer's disease. This is what we're going to do. First, we are going to confirm whether there is immunological cross-reactivity between the worm protein and the brain protein. Then two, we are going to measure levels of pitch1 in plasma and in cerebrospinal fluid of people with nodding disease syndrome. Cerebrospinal fluid sampling is risky and invasive. It involves spinal tap, which is not easy to do in resource-poor conditions. So we would want to see if there's a correlation between plasma levels and CSF levels. Because if there's a correlation, we can in future safely use plasma levels. And two, we will also look at the level of pitch1 in children with nodding disease and in children who are healthy. If we are correct, we will be able to see that pitch1 is low in concentration in nodding disease syndrome, and therefore pitch1 could be a marker for nodding disease syndrome. pitch1 could also be a target for drug development. If we are wrong, then we will abandon the pitch1 link and look for other mechanisms. Please support this project because you will help us provide answers to the children and parents who are waiting for answers in northern Uganda. Thank you.